Many people find that alternative medicine can heal their ailments with less time, money, and hassle than traditional medicine, but others may be a little skeptical.
Right, and here to give us a breakdown and inform us of its uses is Dr. Michael Austin, owner of Rainbow Bridge Healing Arts Center, and you're here to talk about acupuncture today.
I am, specifically battlefield acupuncture. It's a technique that was developed in 2001 by a colonel in the Air Force, Richard Nimtow. He was tasked with coming up with a technique that would reduce the number of narcotics that the soldiers were using in the field. So it's a 5-needle technique. What's interesting about his particular technique is that the needles they're not the typical filament needles. They're wire type needles. These are semi-permanent needles that are inserted, and it's just done in the ear. It's not a body technique. So the needles actually come in these little blister packs. So a corpsman in the field could go to a soldier, pop out some of the needles, treat them. They don't have to take their clothes off or anything, and they can go on their mission and do what they need to do. You can see the needle. That's it. It's really the size of a tick. It's very, very tiny.
So, I mean, obviously we're not on a battlefield, so
Right.
what ailments are we maybe dealing with just here normally that this would help with?
Well, primarily what most people come to chiropractors for is pain management. It's the number one issue that people see their doctors for is pain management, but and more specifically low back pain within that category. So this particular technique, just for the speed of relief, it's literally within minutes. I had a gentleman, a veteran who was in a battle tech situation, was carrying another wounded soldier over his shoulder. He himself got shot. He's on full disability, and he came into my office. He was medicated, and his pain was an 8 out of 10. I was able to get his pain down probably within 10 minutes down to a 2, just using these tiny needles.
Wow, and I mean it takes a lot for a soldier to be on full disability, so he must have been in a lot of pain.
Yeah.
Now, it's so amazing that it's just in the ear, so it can help our entire body, right? There are pressure points in the ear, or it's something like that, right?
Well, the ear itself, I'll back up. So acupuncture, most folks are under the impression that acupuncture in general is owned by primarily the Chinese, but the ear actually was developed by a French physician back in the 50s, so it's fairly new. Paul Noget was the name of that doctor. He had some patients coming in and they had scars on their ears. They were being treated by a local lady in France, in Lyon, in France, and each of them had these scarrings, and he asked them about it. They were being treated for low back pain. He sought her out, asked her how did she learn it. She learned it from her father, who learned it from a gentleman that was traveling through, a Chinese gentleman that was traveling through the town. He helped the gentleman out somehow, maybe helped him stay at the house for the weekend or something as a guest, and in return he taught him how to do this technique. It's kind of extreme. You actually heat up a piece of metal and cauterize the outside of the ear. But the lady was very successful in treating back pain. So Noget then used his medical acupuncture knowledge and sort of backtracked and figured out the rest of the ear, figured out the spine, and then the rest of the systems on the body as well. So yeah, in the medical term for that, as I mentioned earlier, it's called a homunculus. It's not a new thing in medicine, but for the ear, again, in the 1950s is when that began.
Well, and I would think that maybe the challenge that you have is people, one, maybe are a little fearful of needles. Do they feel anything when you're doing this in their ear?
Some points are sensitive, so there's no question, despite the size, some are painful. I've treated myself just in the bathroom mirror, and I've made my eyes cross almost with some of the points. I find that for the most part, folks are open to the idea because the size is so minuscule, and the pain relief that they have is so quick that they're willing to overlook the immediate discomfort of having a needle placed in their ear for those points that are tender. It doesn't happen, it's not for every insertion, just for a few.
So, I mean, we know that you're a doctor. Can you tell us how you got into this type of, I mean, going from a chiropractor to acupuncture? Can you kind of tell us your story and why people should come to you?
Well, I guess I really started looking at alternative health when I was in high school, so a couple of years ago, and I had started taking like Golden Seal to treat my colds and things like that. I decided I wasn't really interested in health enough to go into healthcare. I did a 4-year hitch in the Navy. I was a deep sea diver. After the service, I went and worked in research with General Electric. I wasn't really keen on research. I'm more of a people person, so I decided I'd go back to my original passion with healthcare. I personally didn't like taking pills, so chiropractic was a good fit for me.
And this is
Acupuncture was just a natural kind of segue, and it's I think one of the older healthcare traditions or treatment modalities on the planet, next to Ayurvedic medicine from India.
Absolutely. And you're actually going to be doing a special for people that want to come and try this. As a special for the first 10 new patients, you can receive a free DVD on treating low back pain with atomic body therapy. For more information, you can call 887-2428 or log on to drmichaelaustin.com.